Your genes hold the answers to your family's overall health. I'm Dr. Paula Krupstad, and on the Get to the Root with Hope for Healing podcast, I sit down with experts in genetics, functional medicine, and family care to explore what's really going on beneath the surface so you can stop guessing and start healing. From personalized insights to practical tools, we bring you whole family wellness that starts at the root. Welcome to the Get to the Root podcast. I'm your host, Dr. Paula Krupstad, and joining me today is Dr. Debby Hamilton. Thanks for joining me, Debbie.
Yeah, well, thanks for inviting me. I'm looking forward to our discussion today.
Yeah, and a little bit about Dr. Hamilton. She is a very amazing provider that has a lot of experience. And so basically, not only is she a board certified pediatrician with experience in primary care, but she's also certified through integrative and holistic medicine through AIHM, in addition to the Institute for Functional Medicine. And she also has a master's of public health where she did research in nutrition. And she started her own pediatric holistic consulting practice out in Colorado in 2005. And her practice focuses on treating children with chronic diseases such as autism, ADD, and she also provides preconception counseling. And she's published a book called Preventing Autism and ADD, Controlling Risk Factors Before, During, and After Pregnancy. The other thing about Debbie that I truly appreciate is that she was involved in product development with Researched Nutritionals, specifically the liposomal glutathione, and worked on different flavors for things. And now she has since moved on to Nutrimetics. And we're going to take a deep dive into mast cell activation in children. So, woo, with all that introduction.
Yeah, that's
Yeah.
quite the introduction. Yeah.
And Debbie, too, you also focus on vector-borne illness, and for our listening audience, that covers Lyme disease, Bartonella, Babesia, tick-borne relapsing fever, and there's a lot of that in Colorado. It's everywhere.
It is
And
everywhere.
and then also, when people have a condition called chronic inflammatory response syndrome, or CIRS, or biotoxin illness, and then our immune system tends to go crazy. So I thought I would just ask if you could explain to our listening audience, and we were talking about who our audience is, and I really like to think about it as moms and dads on their commute, moms folding laundry, everyday people. You're trying to get things
Yeah.
done and learn things. So, can you tell everybody what mast cells are?
Okay, sure. So mast cells are part of our immune system. They are a type of white blood cells, and they release all these different kind of chemicals into the body. And these chemicals, one of the big one is something called histamine, and histamine causes a lot of our allergic responses. Think of using Benadryl as an antihistamine, but it also releases something called the cytokines, which cause inflammation in the body. It releases neurotransmitters. It releases enzymes. We probably don't even know all the things it releases. So that causes a lot of reactions, and no one cell is ever bad, right? Our body wouldn't have something. So people are like, oh, mast cells. I'm like, well, they play a role because they help our immune system. But the problem is with a lot of our chronic diseases, we see this in a lot of children, is the mast cells are in overdrive. So they tend to release too many mediators too often, which means like too much histamine, too much cytokines, too much inflammation. And this basically can impact the immune system, right? Because it doesn't turn off. It's
Mm,
literally on kind of that chronic mode in a lot of chronic diseases.
okay, thank you for that basic definition. And you're right. I mean, I think they think now there are over 300 types of mediators that come out of mast cells. We just have no idea.
Right.
So, we have a lot of pharmaceutical agents, like you mentioned, Benadryl, that help to stabilize mast or just lower the histamine. They may not work upstream to the mast cells not to release all these things. And there are chewable things, there are capsules, and there's all kinds of things. But what I really appreciate is that Nutrimetics has now developed a liquid mast cell stabilizer called NutraHist. Now, before we talk about that, can we just walk through some of the conditions where mast cells, these immune cells, are off the rails,
Right.
causing a lot of inflammation, where doing something to stabilize them might be helpful? So, can you go through some common conditions that people might think of when they're considering that mast cells might be involved?
Right. So there's, some of the basic things we think of in terms of like allergies. So think
Mhm.
of eczema, that itchy kind of red skin, or think of asthma in terms of like the constriction in your lungs, food allergies, environmental allergies. Like all the common things are because of histamine. So one part of the mast cell, even anaphylaxis, right?
Mhm.
That's really, really severe, life threatening reaction you can get. People think about peanuts, and that's when you need an EpiPen, is a really a type of a mast cell. When we talk about mast cell activation, often called MCAS, these are when the mast cells, as you said, are releasing too many of these, these basically, chemicals, histamine, cytokines, mediators. And then the MCAS is often in people who have more chronic conditions and chronic inflammation, like you mentioned, vector-borne diseases. So people with chronic Lyme disease often have a mast cell component. People with mold illness is very common to have mast cell. But in our children, children with our autism, maybe a little less on ADHD, but definitely autism or the PANDAS, that autoimmune response, have the elevated mediators. So then they have, so you have to think about this in anybody with a chronic disease, even if they don't have the classic allergy symptoms. Although a lot of kids will have, skin issues. Kids have more skin issues than adults, and they might be reacting to everything, but they can have a host of really, we call systemic or body symptoms. And almost any body system can be involved. So you really
Mm.
have to kind of, and in Lyme disease or mold, you can have all the body systems involved also. So sometimes it's hard to know, hey, this is a mast cell symptom versus, this is kind of from chronic Lyme. And a lot of times they overlap, but it's something you have to think about. I mean, there are
Okay.
some things that are more kind of, makes you think of that. But
Yeah. Well, let's walk through, you named some conditions. Now let's walk through some different symptoms that people may have, say what's going on with their swallowing, their esophagus, their stomach, and their gut. What are
right,
some clues that someone might have excessive release of some of these chemicals from the mast cells?
right. So in the so when histamine's released, it binds to histamine receptor. So there's histamine receptors in the gut, the histamine 2 receptors. So a lot of different digestive symptoms, especially that irritable bowel syndrome, can be related
Mhm.
to mast cells, but it can affect the esophagus. People can get something called eosinophilic esophagus, which means they have too many allergic cells in their throat. So they can have kind of constriction, problems swallowing. And a lot of the people with those GI issues will react to foods. Uh, Certain foods actually can create histamine, and certain foods have histamine, or things like leftovers have a lot of histamine. Hopefully, our children aren't drinking a lot of alcohol, right? Because alcohol is definitely has a lot of histamines. But so you can get a lot of reactions to foods, and you can get a lot of stomach pains, difficulty swallowing, diarrhea, constipation, kind of, or alternating, or kind of, like I said, irritable bowel syndrome is kind of combinations and switching symptoms. But GI symptoms are very common with MCAS
You
issues.
I'm really glad you brought that up because when we think about histamines, one of the things that we start with here at Hope for Healing is we recommend for families who bring their newborns to us and their children to do a precision genetic panel, and it will tell us if they have an inability to break down histamines. And
Mm,
so it can guide the type of probiotic that they use. And
mhm.
so avoiding probiotics that contain histamines is really important too. So that's one of the ways that we can target the immune system. So I really like you taking the deep dive into the GI tract and the gut. Then let's talk a little bit more about the systemic type things.
Mhm.
So when we think about allergic reactions, people obviously think about the swelling, but they have flushing with that. And
Mhm.
then can you kind of go into what might be happening with the heart rate, their breathing? You alluded to it with the conditions that we see, but what are some of those more global, systemic type things that parents or an adult that's listening may be experiencing and they don't know that it's due to potentially these mast cells?
Mast cells. But when I think of the blood pressure and heart rate, there's something called POTS, which is
Oh,
postural orthostatic tachycardia syndrome, which I see a lot, you see a lot with like Lyme disease and mold. But
yes.
if you look at the mast cell symptoms, it's often related. I think if you think of POTS, you need to think about mast cells because mast cells do they can contribute to that increased heart rate, that flushing, the different kind of mottled kind of skin reactions. I mean, they can cause any kind of skin reaction, hives, like acutely, those red cheeks, the flushing through the neck that happens with foods and histamines.
Mhm.
But it can, as I said, it affects your heart rate. You can feel dizzy, and you feel really dizzy with POTS. You can faint. Your blood pressure is not regulating. So when I think about POTS, I always want to make sure I think about mast cells.
Yeah, yeah. Really, it's just so many things. Now, also, when I think about someone who's experiencing all these things, they tend to be very, very sensitive.
Yes.
So when we're and many times patients are like, "Why do I react this way? Why do I feel this way?" And we
Hmm.
have to back way down and go very, very low and very, very slow. So when you're faced with a patient who is presenting to you with symptoms that are overlapping and you want to pursue stabilizing those mast cells or
Hmm.
causing them not to release so many things, can we just go through all of the different, well, some of the tools in the arsenal that we have
Hmm.
available to do that? From, we can talk about NutriHist from NutriMedics. We can talk about some of the prescription things that we might use that might be involved too. So I would love to hear from you, Debbie. I know I'm always telling patients about these things, so it's really refreshing for me to have
Yeah.
someone
Somebody.
unpack it for
Mhm.
me. Yeah.
Yeah. So since the mast cells are kind of releasing too many of those mediators, like too much histamine, so one of the ways is, as I said, you mentioned before, is stabilize those mast cell membranes, right? So kind of decrease their basically putting out too many of these mediators. So, uh, and when I thought about kind of help develop this, so there are prescriptions that do that. Chromium sodium is kind of the
Mhm.
classic one. Now you can use it orally. There's actually a nasal one. And the interesting thing about the chromium sodium is when they studied it versus some of the components of the herbs is chromium sodium will stabilize the histamine release, but it doesn't stabilize the cytokines. And the
Hmm.
cytokines contribute to the inflammation in addition to the histamine, right?
Hmm.
So then there are certain herbs, and a lot of the herbs that stabilize the mast cells are something called flavonoids. And flavonoids, people think of like polyphenols and this resveratrol and all those beautiful colors in our fruits and vegetables. Well, flavonoids are a type of polyphenol. And quercetin is the one that people know most about. Luteolin is another. And so in terms of the NutriHist, a lot of the herbs in the NutriHist have a lot of flavonoids. And one of the issues with flavonoids is if you just take them alone, they're not well absorbed. So you either have to have in kind of a specialized form of quercetin, like people talk about liposomes or phytosomes, like it's in an oil or it's a specialized form, or it's naturally in the whole herb. So you
Okay.
can absorb it better. Does that make sense?
Yeah, it
Yeah.
sure does. It sure does. So the way that it's provided and the way that it's delivered is really critical for doing any good at all.
Right,
Okay.
exactly. And there's studies that if you have like an herbal tincture, you kind of have to take all those great ingredients out, and you do that by alcohol. And Nutrients is actually very low. It's kind of the equivalent of actually some foods in terms of alcohol content. Because I know
Mhm.
parents worry about that. So we know that the flavonoids are extracted in that method because it's a water alcohol, like hydroethanol extraction. So that's kind of one component. The other thing is I mentioned that histamine binds to receptors. So it binds to H1 receptors, which are more peripheral. And so H1 receptors is, when you take Benadryl or Zyrtec or Claritin, the things like the runny nose and the itchy eyes and kind of itchy skin, like with the eczema, right?
D Debbie, by peripheral, can you break that down a little bit more, what
Yeah.
you mean by peripheral?
So I think about more kind of, because we were talking about the H2 receptor, we'll talk about it is in the gut. So when I think of peripheral, it's in like the respiratory tract, the nose, the skin. Does that make
Okay.
sense? So a lot of the
Yes.
classic allergy symptoms
Yes.
are kind of from that receptor. So, in terms of actually over the counter now, you can take an antihistamine, which is usually kind of the H1 blockers. But we have things like stinging nettles. So, there are herbs that actually work as H1 receptors. I mean, I basically block the H1 receptors. So, in
Okay.
essence, it's kind of like you have your receptor, the histamine binds, it causes the action. So, then if you have the H1 receptor, then you take the herb and the herb binds in the receptors. The histamine has nowhere to go. Does that
Mm,
make sense? So kind of like that
yes.
lock and key. It's like the key is blocking, so the histamine can't get there to cause the symptoms.
Yeah.
Does that
So
make sense?
central, when you think about like a central histamine receptor, you're thinking more like the gut
The gut,
or
the brain, or the immune system, right? So
okay.
there's technically
Okay.
4 histamine receptors. So we don't know anything about the H3. It's more in the brain. But right now, there are no herbs that we know and no prescriptions that work on the H3 receptor.
Okay.
So the H2 receptor, you think about all like our antacids, because H2 is involved in the acid production and the stomach function. So think of if you're blocking the H2 receptor, it's like the pepsid, kind of that kind of.
Mhm.
So some people like options for treating mast cells are, oh, an antihistamine peripheral one and an antacid and the cromolyn. So Nutrihist, I designed it to have like the H2 blockers is like black cumin, which is like Nigella sativa.
Yes.
But turmeric is actually the only herb that they found that actually blocks the H4 receptor. And so
Where
the H,
Oh, I interrupted you. I'm so sorry. You
yeah, no,
started to
that's okay.
say H4, where people can find H4
Yeah, so turmeric
receptors.
is the one, and so we did put turmeric in Nutrihist, and right now there's no prescription H4 blocker, but it's the H4, like, so the receptor is actually on the immune cells. So when
Mm.
histamine released from an immune cell basically binds to another immune cell, it's like, hey, the immune system needs to act, right? So it's kind of like telling the immune system, okay, we got an issue. So it escalates an immune response, like the inflammation and the symptoms and all that. Does that make sense?
Yeah, so we've got the peripheral H1 receptors,
Hmm.
and we've got the runny nose and maybe some flushing, and then we've
Hmm.
got the actual immune cells
Right.
kind of telling each other, and the turmeric blocks the H4. H3 is in the brain, and then the H2 is more of in our GI tract.
Yes,
So
exactly.
all
Right.
right. So it sounds just like the synergy of what is in Nutrihist will work extremely well. What is the youngest age that you have used Nutrihist in?
We had one of the people who work in our office had a 9-month-old or 9 or 10-month-old.
Hmm.
So we used it in him. And obviously the dose is really important, right? So we literally did like 1 or 2 drops,
Hmm.
and it helped. So I'm very comfortable using it in terms of
Hmm.
dosing. I do think, having a physician or a practitioner who's comfortable working with you, I think is really helpful. But
Yes.
if you're older than 2 or easy older than 4, I mean, I'm you just kind of, and honestly, even with the younger ones, you start really low always with people because people with mast cells are also really reactive even to herbs, are reactive to everything. These
Mm.
are the people who are like, oh, I'm allergic to water. I go in the water and I get hives. Or they go out in the cold and they get hives.
Yes.
Or, their ears are itching or they're ringing. It's like really every system of the body can be affected by the mast cells and really strange things. With the heart rate, they're, histamine receptors on the heart. That's why when you have anaphylaxis or you have that POTS, your heart rate can escalate when you have an allergic reaction. And things like you wouldn't think of would be involved.
Yeah, yeah. So when you were going through what's in the herbal protocol, now
Hmm.
can you tell our audience a little bit about ketotifen? I'm not sure if
Yeah. Yep.
that's how I pronounce it. Maybe
Ketotifen. Yeah.
yeah, that's how I pronounce it. So when do you use that or what is its role when you're talking about mast cells too?
I think of ketotifen, and I've usually have to compound it. I don't know if that's your
Mhm. Yeah,
experience.
yeah.
I think of it as kind of helping with like the GI mast cell symptoms.
Okay.
So not specifically an H2 blocker, more kind of blocking that thing. And ketotifen for me is definitely, a lot of the prescriptions in my mind, you have to use more than one. It's like
Yes.
I've never seen just using ketotifen if you're just dealing with GI symptoms. And I used to use it, I would do, oh, I do 1 milligram. And I'm like, well, it doesn't really seem like it's doing much. You really have to dose it higher. So
Yeah.
I feel like it's a component, but you have to kind of, in my mind, kind of target the different areas in order
Mm,
to kind of, because it affects so many different ways. Well, if you just decrease the mast cells from releasing, well, the histamine there can still bind. Or,
yeah.
so I feel like a combination approach is really
Yes.
the best. So I do use ketotifen,
Yeah.
but again, I dose it pretty high.
Yeah, so do I. I get up to 4 milligrams twice a day. I mean,
Oh, I
good.
haven't done twice a day. I've done 4 milligrams once a day. I haven't gotten to
Yeah,
twice a day, but you do have to do it higher.
yeah. I I've done that in some patients who were really suffering with a lot of symptoms. And Debbie, I know that you're a pediatrician and so am I,
Mhm.
but with our functional medicine training, we see womb to tomb. Many times we treat, babies all the way up to adults.
Yeah.
And I'm leaning more into complex kids, but I have a few adults here and there too. Just recently had a lady that was really, really suffering, and she had been to the gastroenterologist. They really didn't find anything on her endoscopy other than esophagitis. They
Mhm.
didn't find a cause or an etiology.
Right.
And, I checked her for what we call intrinsic factor antibodies and
Mhm.
also antiparietal cell antibodies. It's just an autoimmune attack on the GI tract, as you know. But we were really pulling out all the stops to try to help her with her discomfort and her pain, throwing in Pepcid and then a product that I'm sure that you have used through Algonaut that has
Mhm.
some of the things you mentioned with
Mhm.
quercetin and luteol, and it's called Neuroprotect, and it also has
Mhm.
rutin, which is very, very clean, and some Pepcid AC, and
Mhm.
also just using, of course, a non-histamine releasing probiotic for her
Mhm.
GI tract, and then looking for any pathogens that might be growing in her gut. But at first, it's just all about calming everything down.
Right.
I mean, she's not wasn't sleeping, and it was interesting using an H2 blocker for a short period of time, a little hydroxyzine to try to help her with sleep
Mhm.
too.
Yep.
But, we just don't wanna use a lot of those things because of the central nervous system effects also. So, NutriMedics, there's a principle called Clark's Law,
Mhm.
and I'm aware of what it is, but you mentioned this, it's like when we have infants to adults.
Mhm.
Can you just explain to the listening audience just the principles behind Clark's Law?
Yeah. I always have to look up the specific numbers, but basically it is it's basically getting the dose based on the child's weight.
Okay.
So there's a calculation, because sometimes a 10-year-old's 100 pounds, sometimes they're 50 pounds, right? There's a big range. So
Right.
instead of basing it on age, base it on size.
Yeah, yeah,
Yep.
and that's just exactly what I was looking for. And,
Yeah.
you don't have to look up the amount. I know that we have the Nutrimetics form
Mhm.
in our patient portal, so we'll pull it up and we'll go, "Wow, by your weight, you should be getting this," and that
Yeah.
kind of a thing. Now, for someone who is highly reactive to
Mhm.
everything, let's say you've ruled in or ruled out they have this chronic inflammatory response syndrome.
Yes.
You've looked at vector-borne illness.
Mhm.
Excuse me, I got plenty of sleep, and I'm
It's
and
Monday morning, it's okay.
yeah, yeah, it's Monday morning. Also, too, we have this rain coming and going and coming and going. I'm glad we haven't had an interruption in power. But when we've identified those things, when you have someone that is really, really sensitive to everything, what are some of the things, how do you slowly ramp things up for someone? And I will say, we have in all of our exam rooms these little glass shot glasses that
Oh,
we
really?
use. Yeah, so we show people or anchor hawking or just, we talk about mixing things in glass and not putting
Mhm.
them in plastic or stainless steel or anything like that, and mixing the herbs. So when we mix some of the herbs with water, what are some of the principles when we do that?
It really has to do with absorption and kind of I mean, there's energetics, there's a lot of different things, but it's really about absorption, right? You kind of put the
Okay.
herbs in and kind of diffuse them in water, and they are extracted in water. So it's
Mhm.
really, being able to absorb it better in the body.
Okay. So
Yeah.
we recommend typically, 1 to 4 ounces, just depending how much we put in there. Let it sit about a minute, swirl it, and drink it. And I like what you
Mhm.
brought up about the alcohol and extraction.
Yeah.
I think that really came from our practice because I had a mom argue with me. She said, "There's some alcohol in this." And I said, "Well, it's actually equivalent to basically eating a ripe banana." And
Mhm.
she was still almost offended that we said that. And I'm like, "No, it's the truth, you
Yeah.
know?" So just, I think, would you just, you briefly talked about this, but when you make the tinctures,
Yeah.
just the safety of it for children to adults. Can you just talk a little bit about that, especially when we compare it to, say, prescription medications?
Right. Right. If you think about kind of herbal traditions for, I mean, centuries, they use herbs a lot together because they have synergy and different functions. But we know that a lot of these active ingredients, just like the flavonoids and quercetin, if you take alcohol and we do alcohol and water, it pulls the active ingredients, right? So you're
Mhm.
extracting all the ingredients into the herbs. So that's kind of partly how you kind of get them more active. So sometimes people use glycerin, which is a kind of sugar, but it doesn't pull you're not extracting all the active ingredients. You're just taking the basic herb and adding a sugar so you can
Mhm.
if that makes a sense. So
Yeah.
the herbs, if they're in kind of an alcohol extraction and a water and alcohol combination, you get more of the active ingredients, so it's going to work better. I
Yeah.
think that's, you have to think about. And I said I've had young kids. Some people you don't want to put it in hot water, right? Because you don't want to kind of hurt the herbs in some way. But some people put in a little warm water, kind of and let it
Mhm.
sit in terms of, evaporation if they're really concerned. And obviously that's an easy thing to do if you're concerned. But there are, in terms of percentages, there are different combinations, and I've seen herbs like or in even like 50% or 60% alcohol, right? And I wouldn't be comfortable giving those, especially if you're giving more than one to a child. But in terms of, the 20%, then I
Mhm.
am comfortable. So I
Yeah.
think that's, you know, I think important to know in terms of how effective it is. And you
Yeah.
also think with kids, they're getting like 2 or 3, 4, maybe 5, 10 drops at the most. So
Mhm.
really the quantity is very, very low.
Yeah. And, the beautiful thing too about the Nutrimetics herbs, if you're treating, say, vector-borne illness, or let's just say Mycoplasma pneumoniae, and you're doing Cemento and Kumanda, and you're working your way up to a certain
Mhm,
number of drops, and then you flip over to Banderol and Stevia, and if you just let it sit there a few minutes,
mhm,
and we always throw in our favorite, which is Berber Panella,
Yeah.
which just yeah, Berber panella is just a beautiful combination. Would you just tell the listening audience a little bit about Berber panella, what it is and what it does?
Yeah. So I think of, and I don't know if this is kind of a drainage remedy, but I think of berber, it's two different herbs. And like when your body, you're trying to detox, or you're trying to process even an infection, you think about the organs that help you do that. It's like your liver going in your GI tract, or your kidneys, or even kind of the lymph system, right? It's kind of like part of your immune system. And there's even a lymph system in your head and your brain called the G lymph system. So
Yeah,
berber panella to me is helping all of those systems work better.
yeah,
So if you're fighting infection and if you kind of treat it quickly, the infection's killed, but then it releases all these particles into the body that triggers immune system. It can make you actually feel worse before you feel better. And
mm,
berber panella kind of helps your body drain those and get rid of those. So
mhm,
you basically you feel better quickly if you're feeling sick, or it helps prevent it. Does
yeah,
that make sense? So it's a kind of a
yes,
great detoxification, but kind of processing, kind of making some of those systems
yeah,
work better. I don't know if
yeah.
that's a good way to explain it, or if you had any other.
I'd like to thank Fagron Genomics for sponsoring our podcast. Without knowing what your precision genetics are, you don't have a roadmap. So please log on to our website, schedule a welcome call, and see what the Wellness Blueprint can do for you. That's the premier and proprietary genetic panel that Fagron has allowed us to create. Yeah,
Comments or
I
or ways to.
yeah, I love that explanation. We use it for what we call Herxheimer reactions
Yeah.
because that's how you clear those things out of your body. And the beauty of Berber is that you can take it every 10 to 15 minutes if you're feeling
Hmm.
really horrible. And the beauty of all the drops from Nutramedics is that you can just go down by one drop, especially if you went up by one drop and you got a
Hmm.
reaction, go back down by one drop, stay there at that amount until you feel back to baseline and then slowly begin ramping up again. You also mentioned G-lymph. I go ahead and say the glymphatic system of the brain.
Yeah.
And one of the things I recommend for parents is to buy those little furniture movers from Lowe's or Home Depot to where they can raise the head of the bed so that when they sleep at night, the
Mm.
glymphatic system is just pulling those gravity kind of pulls that out.
Hmm.
That's the beauty of Berber. And stacking the Nutramedix products are absolutely phenomenal in that you can stack and add so many and they cover so
Hmm.
many things. I think that's just the beauty of herbs in general, that
It
they've been
is.
around for thousands of years. God made
Hmm.
them and they work together synergistically in just a beautiful way. Debbie, while I have you here, I would love you. I just
Hmm.
happen to have, just because I've got it on my desk, I use it.
Yeah.
The
I use it too. I do too.
yeah, the
For like for.
Trifortify. Yeah, it's by Researched Nutritionals, the Trifortify. This is the watermelon liposomal glutathione. There's also an orange flavor. But would you tell us a little bit about what a liposome is?
Yes.
Okay.
So I talked a little bit about, those flavonoids in herbs, because if you kind of isolate them and you basically your body doesn't absorb them well. So
Hmm.
liposomes is literally taking a fat and wrapping it around. And so the glutathione, say you have the glutathione and you take it in your stomach, it switches forms really, really easily. So what you do is you literally wrap it in a fat, like things like phosphatidylcholine, which are part of our cell membranes and actually really good for us. And so in the stomach, it's basically absorbed intact, essentially.
Yeah.
So that's what, that helps us absorb things that are easily kind of broken down or digested in the GI tract.
So one of the questions we get all the time is that it's not on here. It's when you read the label about is it tocotrienols derived
Hmm.
from soy, but parents look at this and then they say, "Oh, it's from soy." And we're like, "No, there's no soy in it. It's just the substance." It says ingredients partially derived from soy and tree nuts, coconut, but it's an ingredient that's in there, not actually a soy molecule.
Well, so
Can you speak into
basically,
that?
It's a soy fat. It's a lecithin,
Okay.
which is
Okay.
basically phosphatidylcholine. So it's not the soy protein, which is what causes the allergies, and that's what our concern is, usually the soy.
Yes.
And so soy lecithin, as I said, that's a source of phosphatidylcholine, which is actually good for us. So that's why people are like, oh, I'm allergic to soy. And I'm like, well, that's okay. There's no soy protein in it.
Yeah.
That's how I think about it. And
Yeah.
when we tested that, in terms of stability, we could not get stability with any other type of phosphatidylcholine,
Nice.
which is why that was the one that was used.
Yeah. I just wanted you to speak that. I tell
Yeah,
people that, but you're the one who helped develop it. And so understanding the difference between protein versus, yeah, so how
the
it's
fat.
delivered.
Yeah.
So that's great. Now, a question I had was about the orange flavor. Would the orange flavor for someone who might potentially, or maybe this has nothing to do with it, have any issue with someone who might be a little sensitive to histamines? Would they choose the watermelon instead of the
Mm,
orange? Because isn't orange a little bit higher in
I haven't
histamines or
ever worried about that specifically in terms of the
okay.
orange, honestly. I
Okay.
will say the orange is not as sweet. So the
Mm-hmm.
watermelon tastes like a Jolly Rancher candy for those of us who
Mm-hmm.
grew up that. So I think for some adults or maybe even kids, it can be too sweet. But most kids
Mm-hmm.
are, the watermelon is a great choice.
Yeah, it's
But I hadn't
definitely.
worried about the histamine with the orange. I did want to say, in terms of just some of the medics herbs, and it's probably true for herbs, is there's a difference between one drop, which is literally one drop, versus a dropper full. So I always make sure, especially if you're starting something to treat an infection, that you don't go, oh, like one drop, and I did a whole dropper full, because that
Yes.
could cause a reaction.
Yes.
So that's why when one drop, literally one drop, I think that I like to explain that to parents specifically,
Mhm.
just so you know a child doesn't get a really large dose right away, essentially.
Yes. I'm really grateful you brought that up. We do the same thing when we talk about our vitamin D. We tend to use a liquid
Hmm.
D3 plus K2 that's 1,000 or 1,000 international units per drop. And
Yes.
we write in all caps, one drop, not dropper full.
Yes, I do that.
Yeah.
I do that all the time. Yeah, because
Yes.
that's important in terms of dose, doing the correct dose. So,
Yes.
yeah, absolutely.
And
Yeah.
mixing and putting them all together. All right. Now, let me see. I think, you really did an excellent job covering everything with the mast cell degranulation or how to
Hmm.
stabilize those. And then the NutriHist, bringing that on. I just adore Nutrimetics products. So thank you so much for helping to break down for our listening audience what mast cells are. They're part of our
Yeah.
immune system everywhere in our body, and they don't just release histamine, but all the other immune modulators, cytokine.
Right.
We talk about cytokines all the time here, just
Hmm.
causing big, bad, yucky brain inflammation. So, yeah,
I like
big,
that
bad.
big bad yucky. That's a good, like,
Yeah,
for kids to understand, right?
that's right. Big, bad, yucky brain inflammation.
Yeah.
I always say
Yeah,
you
that's
can't
great.
unzip your brain and say, look, mommy and daddy, my brain is hot, red, swollen, and painful. But the temper tantrums that we observe. So,
Hmm.
using something to stabilize mast cells, as far as let's talk just very briefly about kiddos on the autism spectrum. PANDAS say they meet the clinical criteria from Aspire.care for PANDAS. Do you work on stabilizing those mast cells pretty much out the gate for lots of those kiddos?
I do. Because as you said, if the brain's kind of on fire, you have to put out that fire.
Yeah.
And so mast cells are kind of, and that you're basically helping that. There are other things that anti-inflammatory. I think glutathione kind of helps. It's
Yes.
anti-inflammatory. It actually impacts the and it kind of helps your body process things, is how I
Uh-huh.
think about it. Really great antioxidant. So it's actually protecting the brain from some of the mediators and inflammation.
Uh-huh.
Things like turmeric, which is in our Ayurveda, and that can
Uh-huh.
be used pretty frequently. It even helps mood. which people
Mm,
don't always think about. So
mhm.
that's kind of a great anti-inflammatory. But again, you have to put out the fire, calm the system down. And as you're calming the mast cells down, less reactive to whatever you're doing to treat the infection or what else is going on, right? Treat the mold, treat the stomach bugs, help the digestion. So that's how I think about it. Is
Yeah.
that
Yeah, that's great. That's yes, we use a lot of the same tools in the arsenal to just calm these little brains and bodies and
Mhm.
just try to get them feeling better. So Debbie, where can people find you?
Well, I mean, my website is holistic pediatric. Or you can email me at Dr. Debbie, and that's Debbie with a Y at holisticpediatric.com. I'm
Okay.
also at Dr. Debbie at nutrimedics.com, depending on what kind of questions you have. But those
Yes.
are two ways to get in touch with me.
Yeah. And are you currently accepting new patients?
I am. I am.
Okay, great. All right. Well, thank you so much for being on today. I'm so grateful and just helping our moms and dads and family members understand what mast cells are and different
Right.
tools in the arsenal. And so, if you're a patient here at Hope for Healing, reach out to us. We use NutriHist. We have some other tools in the arsenal that are very, very similar. Like we mentioned, the Neuroprotect. Um,
Hmm.
to calm those mast cells. And it's just contingent upon the uniqueness of you or your child. For
Hmm. That's
example,
true.
yeah, I mentioned earlier, and I'll just talk about it. It's our proprietary wellness blueprint that Vagrant Genomics has allowed us to use. And we identify, for example, nerve growth factor, if that is abnormal and if it's polymorphed or changed, then we know that luteolin is incredibly effective. So
Hmm.
we love using that. And the polyphenols you were mentioning, flavonoids, polyphenols, as Dr. Debbie said, just these beautiful, bright colored fruits and vegetables that we can derive all these amazing herbal tinctures from and put them all together. So I want to thank you again for being on the Get to the Root podcast, Debbie, and maybe we can have you again on on the podcast at another time, talking potentially about, I think, pregnancy, pre-pregnancy, how to prepare for a healthy pregnancy, and
Hmm.
then how to be in the proactive preventative mode for your beautiful unborn baby. That might be an option. So,
Okay. That would
all
be
right.
wonderful.
Yeah.
Thank you so much for inviting me today. I always like to educate and, the more
Yeah.
people, more parents things you understand, the more you can recognize your kids and help
Yeah.
your kids. So that's
Yeah.
always wonderful, right? That's
Yeah.
what we do.
That's right. Thanks for being on, and I appreciate your everyday people speak, being a fellow pediatrician, because that's
Hmm.
so critical for families. All right. Well, thank you so much. You
You're
take
welcome.
care. All
You
righty.
too. Take care.
Bye-bye.
Bye bye.
Thanks for joining us at Get to the Root with Hope for Healing. If this episode helped you, follow and share it with someone who needs it. And leave a review. It helps others find us too. For a free consultation, visit our website at gettotheroot.com with the number 2 and schedule a welcome call. We'll see you soon.